Good morning, all. I'm Mrs. Deepikashree from the Department of Physician Assistant Allied Health Sciences. Now we are going to see about the types of headache. So the previous video we explained about the types on the pain during the sight and diagnostic and management. Now we are going to explain about the um, tension headache. So tension headache is the one. The tension headache is the most common type of headache. It is characterized by bilateral location. It is usually mild or moderate and not aggravated by physical activities. So tension headache, it is the subcategories into infrequent episodic, frequent episodic, and the chronic episodic. So etiological causes is it is due to sustained painful contraction of the muscle of the scalp and neck. The clinical manifestation is headache, does not involve nausea and vomiting. The main thing is photophobia and phonophobia. The photophobia is sensitive to light. The patient can't be able to see the bright objects during the pain time. And phonophobia, the patient won't want to hear any of the noise because the light sensation, that means bright object, and the noise will increase the pain of the patient. So the patient and having phonophobia and photophobia. The diagnostic test history, taking physical examination, electromyopathy. This test may reveals the sustained contraction of the muscle of the neck, face, and scalp. Another one is migraine headache. So, migraine headache is recurring pain characterized by unilateral or bilateral throbbing pain. Migraine type of headache occurs more in females than male. It is associated with anatomical or nervous system dysfunctions. The etiology is two things. One is vascular theory, another one is second theory. The vascular theory, vasoconstriction followed by vasodilatation, which results in changes in blood flow causes the throbbing pain. The second theory suggests that pain is result from muscular tension and biochemical changes, the changes in serotonin and level. Clinical manifestations are migraine without aura, formerly called common migraine. That is, this migraine is without aura is the most common type of headache. Migraine with aura, formerly called as the classic migraine, it occurs only 10% of the migraine headache or a feeling of pain before it starts. It lasts 10 to 30 minutes before the start of the headache and may include sensory dysfunctions. The visual field defect, that is tingling or burning sensation and paresthesia. So these are the migraine with or without aura is only for a migraine type of headache. So the motor dysfunction is weakness, paralysis, dizziness, confusion, and loss of consciousness. The diagnoses are history collection, physical examination, neurological examination, CT, and MRI are the common diagnostics. Another one is other type of headache. The other type of headache is this is the type of headache may be first symptom of other illness. It should be due to some other illness such as the subarachnoid hemorrhage, brain tumor, trigeminal neuralgia, and any other systemic diseases. And the cluster headache. The cluster headache is involves repeated headache that can occur for weeks to months at the time, followed by periodic or remission. The clinical manifestations: pain around the eye, forehead, cheeks, or gums, swelling around the eye, facial puffiness. So these are all the common pain areas. And the diagnosis is a history collection, physical examination, neurological examination, CT or MRI according to the site and duration and severity of the headache. And the management or prevention, it is just a symptomatic uh, type, it is not the disease one. So preventive medical management of migraine involves the daily use of one or more agents that are thought to block the physiological events leading to an attack. So there are several proven or widely used medication for the prevention of migraine. That is two beta blocking agents, propanol, that means Inderol, and metoprolol, that is low pressor, inhibit the action of beta receptor cell in a heart and brain that controls the dilatation of blood vessels. Calcium antagonist, that means verapamil. Cluster headache are unilateral and come in cluster of 1 to 8 daily, which pain localized to the area of the eye and orbit and radiating to the facial and temporal organs. Thank you.